here with Lauren, our 3-month post-op patient from a facelift and neck lift, and she is about 1.5 years out from a temporal lift and an upper blepharoplasty, and we'll be just quickly reviewing her incisions. So Lauren, if you could turn that way for me. So the first incision, the temporal incision, as you can see, is healed completely. It's typically right where it sounds in the temple, no bigger than just a couple of centimeters here. And you can see the hair grows right through it, and there really shouldn't be any evidence after it's healed completely. And then we're going to continue down. This is a temporal part of the incision. You can see a little bit of a pink line here with new hairs growing through it, and that's characteristic of that incision placement. It curves around and runs right along the line that forms naturally when the ear folds against the face. Runs behind a little cartilage called the tragus here, so it's completely hidden. Then comes out around the earlobe, follows the earlobe back to where the ear attaches to the scalp, and then it takes a little turn and runs in this hairline, same as the temporal, and you can see little hairs growing right through that pink incision. There's a little bit of blotchy pink here just because of healing, recent new blood vessels, and that will fade within the next couple of months and should be imperceptible. Now, if Lauren, if you turn your head this way, tilt your chin up just a tad. There is a little incision here that we use to enter the front of the neck and do some decompression of the deep neck space and tightening of a muscle called the platysma that runs up and down like a sheet and gets lax and saggy with time. So you can see, also tilt your chin down now, Lauren, close your eyes. The upper eyelid incision is typically placed right in this crease, and you can see it is pretty much imperceptible at this point. And opening her eyes, it would fall right into the crease, but it is completely healed. So if you turn a little bit this way, you can see that her jawline is nice and sharp. There's a delineation between the jawline and the neck. We want to see a little hollowness beneath the jawline and a really nice definition here. And her cheekbone is absolutely beautiful and structured. You can see there's really no sagginess or looseness to the skin of the neck because we do trim the extra, and even the little horizontal lines that form with time improve slightly because of the release of the skin and the redraping that happens with surgery. So that's about it. Thank you, Lauren.
Thank you.
Take care.